DOLA patient-ready orthotics. The orthotics podiatrists use. Build orthotic confidence with our support. If you are unsure which of the 9 patient-ready orthotic styles will best suit your patient, the online selector tool was designed to help you. Tell us about your patient and benefit from over 50 years of clinical and orthotic experience, and let us help select the most appropriate orthotic from our range. Access the online selector tool through our website or at the following link, and select Online Orthotic Selector from the menu. Then tell us about your patient, starting with gender, body weight, activity level, and shoe size. In this example, we have selected a male, 60 to 80 kilos, who is moderately active, wearing a US men's size 10 shoe. What would you like the orthotics to help with? This section allows you to provide the goal of orthotic therapy for your patient. Is it for general health and well-being, to improve function or performance? Does your patient have a pathology, or are they a specialty population, including kids or patients with sensitive feet due to an underlying medical condition? If they have a pathology, from here you can select the general region, including forefoot, midfoot, rear foot, lower limb and ankle, leg and knee, or hip and lower back, and then select the specific diagnosis. This example shows the selection of rear foot pathology, and then the selection of plantar fasciitis, plantar heel pain, or heel spur from the pathology list. How does the patient stand and walk? This allows you to select from 3 options: pes planus or flat foot in the pronated foot, a neutral or vertical foot, or a pes cavus high arch supinated foot. In this example, they selected pronated foot. Would you like to add any clinical test results? This section allows you the choice of providing additional clinical test results. In this example, we selected no and will continue. We will explore additional clinical tests in later examples. You will now be provided with the recommended patient-ready orthotic style based on the information provided on your patient. In this case, the pronation patient-ready orthotic in a size medium. You can also select an alternative option, which will give you another suitable option based on the patient information. In this case, the medial patient-ready orthotic was the alternative orthotic recommended. For daily education and training, follow us on social media, including Facebook and Instagram. Subscribe to our YouTube channel, follow us on LinkedIn, or visit dolarorthotics.com.